Welcome to Evergreen Family Medicine. Today we are with Dr. Natalie Moffett and Ashley Miller, the quality coordinator here at Evergreen Family Medicine. And today we're going to talk about the work that goes on behind the scenes at Evergreen to ensure the highest quality care possible. Ashley, where do we start?
So here at Evergreen we have a QAPI team, that stands for Quality Assurance Performance Improvement. And that team gets together with members from across the department, location, so that we have everybody around the table. And we monitor a lot of different things going on in the background. We participate in different quality programs with insurance companies, as well as internally things that we're monitoring and want to work on.
So, Dr. Moffett, what role do you play?
So I basically do what Ashley tells me to do. My job is mostly to be an advisor to make sure that most of the standards stay clinically relevant. A lot of these metrics are coming to us from the insurance companies or from national standards, and sometimes they're not always easily applicable to the patient. So my job is just to make sure it stays relevant.
So a lot of work going on behind the scenes at Evergreen, but how does that impact patients? Where will they see the work that you're doing when it comes to quality in their experience with Evergreen?
One thing a patient is going to notice that their insurance company is going to ask them to do nearly every year is something called an annual wellness visit. These are really specific for our Medicare population. Other patients with a private insurance company might notice it as part of their package as well. Really, this is an opportunity for everybody to sit down, take a pause from some of the acute visits that happen, and really look at, have we hit all of the preventative care measures for the year? As physicians, we are asked to cover so many things from a preventative care angle that sometimes it becomes overwhelming and we forget we're human. So the physical, the annual wellness visit, these are moments when we can kind of stop and look to see, has this person had their bone density testing? Have they had their diabetic eye screens? Have they had their, their CT lung exam for their smoking history? We can really make sure we capture all of those things. The insurance company is asking us to do it as part of a value-based care model, but really at Evergreen, we look at it more as a patient-based model.
Ashley, do you want to add anything to that?
Yeah, I want to talk about some of the things that we do internally just for us here at Evergreen that are really for the patient, like Dr. Moffett said. One thing we're really focusing on this year is monitoring our timeliness and efficiency with our providers and staff. And this ensures that our patients are getting responses to test results, patient cases and questions that they're submitting. Kind of any time they reach out to us, are we getting back to them in a timely manner?
Another element that I see around the discussion on QAPI is IMMS. What is that?
This is kind of a natural outgrowth of our quality monitoring program. We noticed that there are certain patients who seem to always end up at the emergency department. They're frequently getting hospitalized. These are people that the insurance company starts to put on our radar so that we can see, is there something we can do to help these people get more streamlined care from the outpatient setting? If a person is going to the emergency department frequently and for issues that are usually not emergency level care, something is broken in our system. They are not getting access to their primary care provider at the appropriate time. They're not aware of our urgent care needs. Maybe there's some social needs that are being unmet and can only be taken care of at the emergency department. Something is going on. And a lot of times the chart notes, the encounter with a provider just at that moment is not going to be enough to find it. So the IMMS committee is our intensive medical management service, and it is to kind of identify these people and do a real deep dive with the providers, with another experienced group of providers, the insurance company, and a lot of our social workers, our community health workers, our chronic care nurses. Everybody sits down in the same room at the same time, and we just have a round table about this patient. What can we do to get them care and to drive them back to us and sort of away from some of these high-use emergency services?
So what you just said makes me feel like Evergreen Family Medicine is putting their best people on ways to solve some of the big systemic issues we see within medicine in our community. That's significant.
We're doing our best. We're trying with our little slice of the pie here in Douglas County to try and improve care as best we can. We really are trying to focus on this wraparound care model. And one of the ways we're able to do that best, to make sure we're hitting all of our preventative care stuff, we're taking care of the acute issues, and we're sussing out if there's something under the surface that's really affecting a person's health, is through our QAPI committee.
All right, well, clearly there is a lot happening behind the scenes at Evergreen when it comes to improving the quality of healthcare in the community. So thank you very much for your work and for your time.
Thank you.
Thank you.
Dr. Natalie Moffett and Ashley Miller, the quality coordinator here at Evergreen Family Medicine. Keep track of what's happening at Evergreen online at evergreenfamilymedicine.com and follow us on our social media platforms, YouTube, Facebook, Instagram, and Twitter.